if Dr. Spencer would go back in time and talk to Neve, who was 20 years old, what advice would you tell your 20-year-old self?
Don't take no for an answer. Always say yes. And when you're given a seat at the table, make them wonder why it took so long to give you the seat.
Wow. When you're given a seat at the table, make them wonder why it took them so long to give you that seat. Wow. Those are some golden nuggets right there. Golden nuggets.
Welcome to Straight Talk with Dr. Erik.
Hi, everyone, and welcome back to Straight Talk with Dr. Erik. On today's episode, we have with us the Chief Nursing Officer of HCA Florida University Hospital, Dr. Neva Spencer. It's so nice to have you on the show.
Thank you. I'm pleased to be here.
Great. Well, look, I'm a numbers guy, as I said before in a little pre-talk, and I want to put things in perspective for the audience. HCA Florida University Hospital was built in November of 2021. It was a $360 million project. That's a lot. It has 650 employees, out of which around 350 are nurses. Now, if we put things in perspective, that means huge organization, $360 million to build, right? Half of the employees who are running day to day are under your leadership. As I mentioned before, you have help, you have your team members. I get it. But ultimately, you're the CNO, you're the Chief Nursing Officer, and it comes to you to make those decisions. But before we talk about Dr. Spencer, I want to go back in time and learn a little more about Neva, the little girl who was growing up, who went to high school, to college. Tell us a little bit about your journey and some of the highs, some of the lows of how you got to the position that you are today.
Well, I had a very interesting journey. I actually was born in Heidelberg, Germany.
Oh, wow.
Yeah, and my father was in the U.S. Army. So some people call me a military brat. He retired when I was about 5 or 6 years old, and I'm the youngest of 4 children. Big gap between my siblings and I. I think my parents finally got it right. You know, they waited a while, and then they had me and went, okay, we're done. But I benefited from having those older siblings. But when my father retired, he and my mother moved back to their home area, which was rural West Virginia.
West Virginia.
Yes. So I grew up 4 miles up a dirt road on a farm in a town called Jane Lou, West Virginia.
Wow.
Yeah, it's about 110 miles south of Pittsburgh, Pennsylvania, and about 100 miles north of Charleston, West Virginia. So I had all the wonderful opportunities that growing up on a farm gives you. We had about 1,000 acres, and we had
1,000 acres of land.
That our farm compared to my grandparents, and my grandma Neva lived on the farm next to us. So I was named after my grandmother, and no inheritance tied to that though. But I've carried that name around for a long time. So we grew up on this farm, and it was wonderful. Great parents, and with being on the farm, we had animals, we had cattle, we had horses, we had chickens, we had ducks, lots of dogs and cats, of course. And I learned to be a caregiver long before I ever thought about being a nurse.
Wow.
I was, my dad would mow hay, disrupt a little bunny nest, and bring home little baby bunnies that I would put in a shoebox and drop or feed. So we did that kind of stuff all the time.
I would assume then that there's a lot of hands-on on the farm. You've got a problem. You're not, hey, let me call it. Like, you got to fix the problem.
Yes.
And,
Yep, absolutely. And it's funny because my dad would have liked for me to have been a veterinarian instead of a nurse, I think.
I mean, yeah.
And I joke and tell people the first cesarean section I did was on a cow.
Really?
And I was 12. And I helped my dad.
No way. Are you serious?
Serious, yes, on the farm. So, I helped my dad and the vet do the cesarean section on a cow. We were going to lose the cow. We didn't want to lose the calf too. And then that calf came and lived in our basement, and I bottle fed it because it was winter and it was cold. And then the great things about animals, they're so accepting, so forgiving. When we had another cow that had a calf, we just slid that second calf in, and she nursed it and cared for it. And it was wonderful. So I learned about being a servant leader and a servant person, even taking care of those animals. So
Early on when you were a
early
little
on,
child.
yeah,
So it's
early
interesting
on.
how experiences when someone is very, very young, how they really are able to shape some of the characteristics of who we become. And that's where
Exactly.
that love for that care, now I see the connection. Go on as far
Yeah.
as,
So, loved living on the farm, was very active in school, but early on knew I wanted to be a nurse. Saw a movie when I was a child, not the best movie for a child to see. My aunt and uncle took me to see MASH, the
okay,
original movie.
uh-huh.
Happened to be right when my dad was in Vietnam. And here is this little girl watching this movie thinking maybe I'll see my dad on TV because there were all these men in uniform. And I knew that's what he looked like, right? So watched that movie and saw a nurse that I connected with because she was empowering. And it was Margaret Houlihan from the movie MASH. So saw that nurse and I went, look at how she's knows exactly what she's doing. She's confident in the way she presents herself. She's making a difference and she's leading in difficult situations. So early on, I was like, I want to be a nurse. So when I was in about probably 8th grade, my aunt had a premature baby and we were visiting them and a helicopter landed to take him to a neonatal intensive care unit. And I watched the transport team pick him up and take him to the University of West Virginia. I was in about 8th grade and I
It's
said,
13-ish.
yeah, I said, I want to be a neonatal nurse practitioner. That's what I want to do. I want to take care of sick babies.
I'm getting some chills because I know that you were a neonatal RN and NP, I believe.
Yes, yes. And that I was like, I'm going to take care of sick babies and I want to, just make a difference for families. So when I was in 10th grade, my high school had a wonderful VOTEC program, Lewis County High School in Lewis County, West Virginia. But the programs they offered were not something that resonated with me. They offered auto mechanics and welding, that type of thing. However, in the next county over, our, rival county, so to speak, they had a medical office assistant program. Well, I was fortunate enough on the farm, our neighbors, Helen Morrison, wonderful lady, second mother to me. She was the secretary at one of the high schools. So my parents and I talked with her, and she allowed me to ride to school with her every day for 2 years so that I could opt in to the high school in Harrison County, South Harrison High School, so that I could benefit from the VOTEC program in Harrison County.
And the VOTEC program was what?
A medical office assistant program.
Medical office assistant
The reason
program.
I picked that was I thought it would help me with anatomy and physiology. It would help me with medical terminology.
Is that like a medical assistant
Yes.
nowadays?
Exactly.
So you really had this dream, started on the farm with animals, then saw your relative needing to be transported in a helicopter, right?
Yeah.
And at 13-ish, you said, oh, this is what I want to do. And then you pursued it step by step by step. So what I'd like to find out is a lot of people who have a vision of what they want to do, people think it's just going to be easy. Like, oh, I want to do this. I want to be the CEO of a hospital. I want to be a pizza shop owner, a millionaire, whatever. Like, it's not easy. People don't understand the amount of effort it takes and the ups and downs. Can you go through some of those things where, like, life kind of pushed you down, you were on the floor, but you remembered that 13-year-old child who saw that neonatal situation, said, I want to do that?
Yeah, it's you're right. Not easy, extremely worth it. It's the career I always wanted. And going back now, I've been a nurse almost 39 years. There's not a day that I thought it was the wrong career for me. So really love it. And I connected with it. And I don't know if I am the way today because I became a nurse or I became a nurse because of the way I am. So it was opportunities where as a 16-year-old, I had a boyfriend at that other high school who was a football player. I changed high schools. I went to the rival high school.
Wow.
And, it was not easy getting up earlier than I needed to if I were riding the bus so that I could ride to school with the secretary at one of the high schools. I had to meet all new friends. I had to meet teachers. I made good grades, but I didn't know any of these teachers. And in small town West Virginia, everybody knows everybody, but not when you cross the county line. Everybody's new. So I switched high schools. I went on this medical office assistant journey, and it opened a lot of doors for me, which I was very beneficial for. Through that program, I did learn a lot, but we also got to do clinicals. One of the clinicals I got to do, very fortunate, they put me in a pediatrician's office. So here I was working with babies and working with children, which is exactly what I wanted to do. And these two pediatricians were the only pediatricians in about a 60-mile radius. So all the babies that came out of the West Virginia University NICU, which is where I wanted to grow up and work, often came to this group of pediatricians. So they were able to put my name out to people as I was applying to nursing school, as I was applying for jobs.
So there's a couple of
making
things,
connections.
a couple of things I want to unpack with what you're saying, Dr. Spencer. Number one is the begin with the end in mind, right? You began with the end in mind. You knew what you wanted to be, and then slowly but surely you started to go towards those steps. So that's very, very interesting. The other thing, as I'm hearing your story, comes the quote, the harder I work, the luckier I get.
Yeah.
Right? So the harder that you worked, you had to make a sacrifice. You had a boyfriend. You were 16. He was on the football team. Oh, my God, this is the dream for every 16-year-old girl, right? And you got to put that aside to focus on what you want to do and what your mission is and your vision is. So that's incredible. I want to switch gears, and I want to talk a little bit about leadership. There's a book, and it's a book that's by Simon Sinek. It says, Start with Why. And he says something that touched me. He says, managers tell people what to do. Leaders help people understand how to think. They teach people to think, which is very, very different. And being a leader like yourself in a very, very in an important environment, such as a hospital system, understanding that it was built, like I said, for $360 million, it's kind of on your shoulders to make sure that investment is the right one. You're leading those 350 plus nurses. Tell me about your leadership style and some pointers to people listening, the audience, about leadership.
Yeah. Well, I think my leadership style evolved over the years because you have a different leadership style when you're a bedside nurse or a nurse in the NICU. And then I became a neonatal nurse practitioner at 23. So I was an informal leader at the bedside, and I was only 23 years old. But they're looking to you to make decisions. So I really appreciate Patricia Benner's model, novice to expert. And I think it's a nursing model. And I think everyone falls under that, whether it's you're new to nursing or you're new to leadership or you're new to medicine. You get to be a novice. And one of the important things as you develop your leadership style and in being a leader is allowing people their novice phase, allowing people to make mistakes.
You know, that's so hard, by the way. Because when you're at a certain point and you're C-suite or what have you, and you need things to be done, and you see those mistakes, you have to kind of control yourself. Calm down. They're a novice. Don't go, why'd you do it this way? No. So patience.
Yeah.
That's interesting.
Yeah, and everybody deserves that. And as they go through, from novice to competent to expert, there's several steps along the way. They get better and their learning curve changes. But then when they change a job, when you promote someone from a manager to a director, they're a novice again because you've given them a new book of business. It may be a familiar book of business, but there's still elements that they haven't done before. So they move into that novice phase again. The learning curve is quicker though. So I think one of the keys to my leadership was I had people that allowed me to be a novice. I had wonderful mentors that said, you're an expert at being a neonatal nurse practitioner, and now you're a director, which is a completely different thing. You made a difference for patients at the bedside. Now make a difference for staff who are caring for patients at the bedside. And it makes you go more horizontal in your leadership and less vertical. because you can't micromanage, and you don't want a team with you that needs micromanaged, which means the way you don't micromanage is you help them grow. One of the highlights of my leadership career is when one of my leaders gets promoted, when one of my staff gets promoted, when one of my staff gets an opportunity to not work with me, but to go work with someone else, because it means I'm leaving a legacy. They're taking a little bit of me with them, and they're taking a little bit of all the people that were important to me along my journey from, a medical office assistant to, becoming a CNO. So it is that pollination across healthcare. And it's not just nursing. I know when I was a neonatal nurse practitioner, I had medical students who would follow me to learn resuscitation of the newborn residents, because they knew the NNP was the person in the delivery room. And I know there are pediatricians and neonatologists out there that I made a difference to, and they made a difference to me.
So that's incredible. You also mentioned before we started about commitment, right? Style of leadership. And I remember listening to a podcast with Jeff Bezos, and he said, some of my team members, I have this thing where I tell them, look, you could disagree with me, and that's fine. We don't all have to agree on stuff, but you could disagree and still commit to the mission of what we're trying to do. So how important is commitment in leadership among team members and among leaders as well?
Yeah, and I think early in my leadership, it was I commanded people. It was, come on, we have to do this, just do it. The Nike motto is not the best leadership style, just do it, right? And then
just get it done.
Yeah, just get it done. And then you compel people to do it. It's like, come on, I won't, get me off this list, help me, and that's that compel leadership. But the commitment leadership is, to me, we're on the same journey for the same reason, and we can't do it without each other. And you're right, we can disagree when we walk out of that room. I respect you, you respect me. We'll get this done together. But at some point, the decision needs to be made. Right. And I need my team with that.
To support
now,
me.
What you do in that from, what is our goal in mind, I need their help in the journey so much. But sometimes, when we look at evidence-based practice processes, the decision is made. We need to get there. They know the journey better than anyone because they are at the elbow of the staff. They are talking to the patients. And we can come up with a whole lot of good ideas, but if we can't operationalize it at the bedside, all it was a good idea. So I need their input on the journey, and I need them to be with me in the commitment of, this is the right thing to do for our patients. And you're right. Let's have all those conversations here around the table in my office. So when we walk out
and we commit
we're
together,
united front. Right.
That's awesome. Yeah. That's awesome. Those are important points. I want to shift gears and talk a little bit about continuous drive for growth. And looking at, especially hearing your story now, you went from the medical assistant to the RN, to the NP, to the DNP, which is a doctorate of NP, and to CNO. Why this continuous drive for growth? With each level, there's a new challenge, there's the new thing you have to do, and time and resources and energy. Why do all of that?
Well, I think nursing is a lifelong learning profession to start with. You don't graduate from nursing school and say, I'm done, because every time a new therapy comes out, you have to learn about it. We are doing things now in medicine that almost 40 years ago when I got out of nursing school, we would not have even thought about. So you have to be a lifelong learner. And if you're not a lifelong learner, you're failing your patients and their families and our communities. So nursing inherently is a lifelong learner. But as you said earlier, the harder you work, the luckier you get.
Yep.
And to me, the harder you work and the more you achieve, you realize, but that's not enough. So it is, when I was in my school journey, one of the things, I got waitlisted for nursing school. And I was like,
and after all the stuff,
I'm not going to be waitlisted for nursing school. So I stuck with it. I was able to start on time, but I got an associate's degree to start with, so a 2-year degree, so that I could become a nurse as fast as possible.
So that didn't stop you, meaning when that happened, you didn't like cry about it, oh my God, and like spend 5 months being depressed. You said, no, okay, this is what happened. What can I do to get out of this situation to still reach my goal?
And it's funny because when I got that letter from Fairmont State College in Fairmont, West Virginia, great school, that waitlisted me, my first thought was, oh my goodness, what's my nursing journey going to look like now? And my second thought was, they're wrong, and I'm going to show them.
Wow.
And then I was able to get into Fairmont State, and I've actually, now that I have my DMP, thought, I just want to go back and show them.
Wow.
You waitlisted me in 1984, and now I'm the CNO of HCA's newest, prettiest hospital with the most investment, and they were wrong. I didn't let them make me believe.
Just
that
the
I was
opposite.
wrong. It was a drive.
It was a fuel for
For
you to go even further and harder up.
Exactly. So I got that associate's degree, and then I became an NNP with an associate's degree, which that was back in the day when you could do it with a certificate. And I could have stopped there, but I said, no, I want to keep learning. I want to keep going to school. So then I got my bachelor's in nursing, and then my master's in nursing, and then my doctorate. And I will say one of the beauties of HCA healthcare is tuition reimbursement programs. They hired me as a 20-year-old nurse. I moved to Denver, Colorado, about 6 months after I graduated from nursing school. And they hired me to work night shift in the NICU with an associate's degree. And they kept investing and investing and investing in me. They hired me in 1987, and in 2013, I finished my doctorate, all with tuition reimbursement assistance,
and that's
while I worked full-time for them.
Wow.
No.
And, that's what I noticed. I looked at Dr. Spencer's LinkedIn. One of the things we look at is like, is a person in one position for 6 months and a year and then bouncing around and have 30 different positions? Some of the positions you were in is 5 years, 6 years, 10 years, like really living in that organization, believing in that organization. Obviously, if the organization is keeping you for that long as part of the team, as part of the family, that means they feel that you're bringing value to the table. Yeah. And it's incredible. And I also resonate with what you said about the continuous drive to grow and to learn. Charlie Munger, who was a partner of Warren Buffett, he recently passed away. He was a billionaire. And he said something. He wrote a book called Poor Charlie's Almanac. And it's kind of like a similar book to Benjamin Franklin's Poor Ben's Almanac. And in that book, he says, go to sleep every day a little bit wiser than when you woke up in the morning. And that compounds day after day after day. And looking at your journey, it seems, and I see it, you're all about that continuous every day. What can I learn a little bit more? Tomorrow I learn a little bit more. And you look at a year and you're like, wow, I've come so far because I've learned and I invested in myself. Speaking about learning, speaking about growth, I'd like to talk about mentorship. So I'm on the board of South Florida HIMSS, and one of the initiatives that we have is called the Mentorship Program. And that's where we pair mentees to mentors, and mentors are C-suite execs, CNOs, CEOs, CMOs in the healthcare informatics space. And it's so beautiful seeing that union of how they grow and both exchange ideas. And we're actually going to be speaking about this in Las Vegas at the HIMSS conference. Myself, Dr. Bronsberg, and Kendall Webb are going to be speaking about that to a whole bunch of folks presenting. Can you tell us about one person or a few who is special to you and mentored you? And also, what is your view on mentorship? How do you look at it?
Well, I think mentorship is very important. HCA actually has formal mentorship programs for our nurses. We do. And each division in HCA kind of does a little different. In the East Florida division, where University Hospital is, it's called the Kamatua program. And it's based off the Kamatua warriors and how they mentor the younger people. And every one of our new grad nurses is assigned a big K, we call them, and we call them little Ks.
I like that, big K, little K.
And it's not just about mentoring to learn how to do your job. That's not what mentorship is. To me, mentorship is helping you grow as a person, and it can be inside the profession or outside the profession. But mentorship, very important. And I've had 3 mentors that really have resonated with me over the years. I had a personal mentor, and then I had a professional mentor.
Right.
But one of my personal mentors, her name was Linda Rowan. And Linda is the chief nursing officer at a critical access hospital in rural Colorado.
Wow.
In Brush, Colorado, East Morgan Community Hospital. Shout out to them. Linda's getting ready to retire. We're so excited for her. But Linda taught me patience. When I met her, I was a neonatal nurse practitioner. So it was get a sick baby, deal with the
Let's get
baby,
it
get ready
done.
for the next crisis.
Right.
Linda taught me to slow down and to be patient. She looked at things so holistically, never missed a deadline, but never looked ruffled, never looked like she was fast paced or rushing, never didn't have the time to stop and have a deep and meaningful conversation. And she told me once that she developed that because she has a daughter who's developmentally delayed. Lisa is her daughter, and I love Lisa to death. They're getting ready to come visit me. And Lisa has a chromosomal abnormality. And even though she's in her mid-40s, she'll developmentally always be 4. The wonder of the world, asking questions,
Wow.
her own pace. And Linda and Lisa really have such a great mother-daughter relationship, but it really forced us to slow it down and look at it from the eyes of someone else and a child. So Linda taught me patience, to downshift and take it all in.
Patience is so important.
is.
And it comes with time. It comes with professionalism.
My other mentor was Susie Ketchum. Susie's now retired, and she taught me about professionalism. She was one of those nurses who was working and on faculty at the college, giving back to the new nurses, doing student rotations, and saying it's not just enough to make a difference for that patient. Let's make a difference for the next generation of nurses. Let's make a difference for our professional organization. And she was actually the president of the Association of Women's Health Obstetrics and Neonatal Nurses. That's how much she gave back to our nursing profession and our specialty profession. And then the third mentor, which was kind of a co-mentor, Dr. Zach Mueller, and then Carol Gregory. Carol and Zach were my CNO and my ACNO at the Medical Center of Aurora when I was a neonatal nurse practitioner. And I was making a difference at the bedside, was very good at what I did, and never wanted to get into leadership because I wanted to be at the bedside. And Carol looked at me one day and said, "You are an informal leader at the bedside, and I want to tap you to join this new committee we have as we take our magnet journey for ANCC magnet designation for hospitals." It's basically the gold standard for nursing, the gold medal in nursing. Less than, I believe, 6% of the hospitals across the country have it.
Can I guess what you said when you were offered that
Right.
that opportunity? What did you say?
I said, I don't want to leave the bedside. I don't want to get into leadership, but I will join your committee. And that was her way of slow playing it. So I joined her committee, and it made me look outside of our women and children's service line.
And by the way, that committee, it wasn't like you got a bump in salary or hourly. It was a volunteer position that you said, I will allocate my own time, join the committee, bring value without getting anything back financially.
Yeah, exactly. I wanted our department to have a voice in this really important journey.
Right.
And so when she said join this committee, I said, oh, okay, I'll join that committee. And I joined the committee, and it opened up my eyes to, I thought we were the only ones doing great work in the hospital, women and children's. And then I developed relationships with nurses in other departments, with leaders in other departments, and really began to appreciate how it was truly a holistic journey that we needed to make it better for all the nurses and all the patients. And then she asked me if I would step in and be the interim director of women's. And I'm like, I don't want to be she said the director of women's. I said, I don't want to be the director of women's. I love being at the bedside. So then she got me. She said, what about interim?
Just for now.
Try it on.
Try it out.
Just interim. I need somebody to be in the role.
Wow.
And I think you'd be good. The doctors respect you. The nurses respect you. You're doing all this work with Magnet. And that was about 2 years after I had joined the Magnet Committee that she made that request of me. So in December of 2008, I stepped into the interim director role. And then in about June of 2009, she looked at me and she said, "We just haven't found any candidates that will do as good a job as you. Will you please consider the full-time job?" By then, she had inspired me so much and empowered me and helped me see myself as a leader, as a formal leader, which I hadn't seen before. And I had started pursuing the Doctorate of Nursing Practice program at the University of Colorado, had been accepted into it, and said, yes, I can see now how making a difference for the staff so that they can make a difference for patients and their families. So again, it was that, how do you look horizontal and not vertical, and how do you pollinate across?
And I think as you're speaking, a quote comes to mind: the more you give, the more you get. There's a lot of people who say, well, I want this, and I want this, and I want I. No, hold on a sec. Why don't you give? Why don't you help? Put yourself out there. Like you said to the committee, okay, I'll do it. Interim, okay, I'll do it. Yes, yes, yes. And you gave, and that's how you grew. And I'm sure it wasn't comfortable to be a new, like you mentioned before, you're comfortable at one level. You're great. You're 100%. Now you're jumping to a completely new level. You haven't done it before. You're not going to be 100%,
Right.
but you have the potential to do 100%.
And that's why having good mentors in your back pocket and a good support team, because I was a very good NNP. I was teaching in neonatal nurse practitioner programs. I was training residents on how to resuscitate babies. So to go into a meeting about finance and not understand the words coming out of their mouth, I was like, it's humbling, and I so appreciate that.
How did you level up?
Moment of being humbled. I went to people like Dr. Zach Mueller and Bill Volich, who was my chief financial officer, and behind closed doors said,
Help me understand.
bring me up to speed. What do we mean by this? What does this acronym stand for? And
did you do any reading on your own as well?
I did do a lot of reading on my own.
I said a little, you said a lot.
A lot of reading on my own. But the good thing was, when you have a good support team, not only do they help you learn what you need to know, they help you realize there's some stuff you don't need to learn. Don't waste your time on that. We've got a team that will provide you that data. You don't need to know how we calculate that. I'm going to provide you the number. Believe the number. And then you trust them, so you do. You have to have a working knowledge of it. But so they allowed me time to target my focus because they filled in the blanks for me. But it was people like Dr. Zach Mueller and Bill Volich who, were my, finance people. And Dr. Mueller is an excellent nurse, and he's a division chief nurse in HCA now. And there were many times I'd walk in his office and go, I feel lost. And he's like, you're not lost at all. You're not lost. Took a wrong path doesn't mean you're lost.
Wow.
Right? So,
and
he was wonderful.
Dr. Mueller, I can only imagine during that, like going into that scene, he's probably having his own things that he has to do, right? He's busy. He's probably overwhelmed with a lot of work and responsibilities. And here you come in with your set of concerns and saying, oh, kind sir, or Mr. Smith, or doctor, can you please put your stuff aside and help me out? And for him to say, don't worry about it, you're not lost, just, we got to redirect you and spend the time. That's true leadership.
Yeah. He made the time for me. And that's one of the things, the people that helped shape me made time for me. And so that's what I try to do with my staff. We say things like we have an open door policy.
Right.
Every
has organization says that.
But understanding when people need you to stop doing what you're doing and make time for them now, as opposed to, let me know tomorrow what help you need. Because sometimes looking at someone and saying, let me know tomorrow, gives them the time to figure it out. And they need that sense of accomplishment.
Yeah.
And then sometimes they need you to stop right now. But I think one of the other things that important mentors helped me was when we talked about, the different leadership styles, it's the messaging, right? So sometimes you give a difficult message that people don't want to hear. Sometimes they can hear the message, but the way you present it, the messaging is what's
Right.
difficult.
Right.
And then sometimes it's a messenger that's difficult. So really, I had a wonderful mentor, Erik, who helped me understand that concept. Is it the message that they're having trouble with? Is it the way you're providing it, the messaging?
Or is it
Or
a
does this person have
messenger?
an issue with you? And I think you have to have that self-reflection whenever your goal is not resonating with others. Is it they're not understanding, they don't like it, or they have an issue with the way you're presenting it? And, she said to me, you really do have to think, does this need to be said? Does it need to be said now? Does it need to be said now by you?
Wow.
Because we all process at different
Wow.
paces. I, at times, process fast. But when you're in a room with people and we need to all be on that same journey and we all need to commit to the same journey and the same outcome, sometimes you have to let them process at their speed to get where you need them to be.
And you know what you've just mentioned is just gold, because many of us, we're very driven and we want to get to our goal as soon as possible, right? The patience that you've talked about. And sometimes you just don't realize or don't think that the other folks may not be on that same wavelength. They want to get there, but it's not the same frequency as you are. And you're right. It's, the message, the messaging, and the messenger. And anytime any of us want to drive an initiative, I think you should take a step back and look at those three components, because they're key to your success of accomplishing that goal or the mission. That's gold. That was gold. I'm sure a lot of people listening out there are going to find that
I hope it's helpful.
super helpful, really. I want to shift gears into innovation in healthcare. One of the things that I'm involved in with Medicare, we are very, very humbled and honored that we have a guide model partnership with Medicare focusing on dementia. Going to help a lot of caregivers with respite care. It's incredible. I love innovation, especially in the elderly, especially in folks who we can help out and caregivers. But I also know that there's a lot of innovation happening on the hospital side, on the nursing side, on the patient side, on the patient experience side, on the nursing experience side. Tell us a little bit of some of the innovation going on at HCA Florida University Hospital.
There's a lot of innovation going on in HCA, and HCA Florida University Hospital really gets to benefit from that. It's one of the really and wonderful things we have. We were a pilot location for a virtual nurse program. So I have 40 beds on my 4 South side. Wonderful leader up there, Colleen Dennis. She's making a difference, working with the staff, great staff over there. And we have a virtual nurse program where we partner with our corporate team. And when a new patient is admitted to the floor, there's actually a nurse that comes on a large television and helps do their admission history, helps do their med reconciliation.
Through the monitor?
Through the monitor. If they're on a big TV.
How's that experience
They
that you
can
found?
see
The patient experience?
The patient can see them. It's really nice. There's a little knock. The patient says, come in. Our nurses go in and tell them ahead of time, we have a virtual nurse that's going to help us with your admission. Not do it, help us. It's in addition to, not instead of. And I think that's important for the patients to know. So they're doing, some patients it really resonates with. They see the benefit, it streamlines the process. And to be honest, there's some patients who, I don't know who that person is. I'm hard of hearing. I didn't hear him knock. So, we work with our corporate partners. We're like, can you turn up the knock sound? Can you call the nurse first? Things like that. They're very accommodating in doing those things, because not every person is as open to innovation and technology.
That's what I would think, especially
Right.
how do you find in the geriatric space when you're looking at a 85-year-old female who came in with a pneumonia and she has a daughter with her? How's that shift from having a nurse? You said it. You're not replacing
Right.
the physical nurse, but how is that shift in understanding from the patient and caregiver experience?
Right. So you're absolutely right. Everybody receives it a little different. And it's interesting because it is in addition to. So some patients, they like it. And then the nurse goes in and says, so the virtual nurse did your admission history and med reconciliation. Let me go over that with you. And
To
they're
review that.
review it. And they're like, oh, yes, but then I remembered.
I
So
forgot
they
to tell
almost,
you.
some really like that second
Layer.
level.
Mm-hmm,
Right.
mm-hmm.
And then others are like, I already told them, and they're very in tune with technology, and it's great. And some of them are, couldn't hear what they were saying, or I didn't understand what their role was. And that's an opportunity for us to have done a better job to prep them for it. But our virtual nurses also know exactly what nurse is caring for that patient, and they can call or send a text to the nurse saying, not sure they were hearing me. You might want to ask these questions again,
Yep.
that kind of thing. So it's a great partnership. And they also can do discharge teaching. And so that's what's really
That's
nice.
huge.
Yeah, it
That is
helps
huge.
streamline and improve our throughput to where the nurse can come on and say, you're being discharged today. I'd like to go over your discharge teaching with you. And then your bedside nurse, before you leave today, will also answer additional questions.
I love nurses, and I love bedside nurses. I remember myself as a resident physician, first-year resident. I'm on the 8th floor of a New York Methodist Hospital. It's Cornell now, Weill Cornell. It's the stroke unit. And I got my long white coat. I got my beeper. I feel, I'm the man.
Did
right?
you have a
I'm the
stethoscope
doctor.
around your neck?
I had
Of
the
course you did.
stethoscope, right? I'm looking all nice. And it goes, "Dit-dit-dit-dit-dit-dit," and I look at it, and I'm like, I call. And the nurse says, hi, Dr. Erik. You know, the patient's blood sugar is 420. And this is like my first week off medical school. And she's like, what would you like for me to do? And I'm like, I have no clue what to do. And I say, well, nurse, thank you so much. What do you guys usually do in that situation? And so she told me, well, we give this much. There's a sliding scale. There's this amount of units of insulin we can give. And honestly, I was taught the first year by nurses. And I saw the love and the care, but I also saw how overworked nurses were with documentation, with admissions. And I saw that their shift ended at 7, 8, whatever it is. They stayed till 10 off the clock, documenting, doing other things. And I know you know that from the past, being a nurse for many, many years. And so introducing new innovative technology, if you can lessen that burden, lessen the burnout, and you know, a year or two ago, we had a huge exodus of nurses, right? Lessen that. That is impactful.
We have an excellent chief informatics officer in HCA. Her name is Sherry Hess. She actually was a neonatal intensive care nurse with me in Denver, Colorado. I was the NMP. She was one of my NICU nurses.
Wow.
So I've known Sherry a long time, and she is so focused on that. How do we make the important work of nursing a little less burdensome? Down to how many keystrokes does it take to document something? How much time does it take to recall? How much time does it take to look at the previous shift's documentation? And so we're doing a lot around that. We have so much technology in the hand of the nurses on phones called iMobiles, where they can see every person assigned to the care team, what the labs are that are pending, how to contact the doctor. Is the patient, we have spot alerts that go out, which is a sepsis early alert program. So HCA has invested so much in technology, not just to make nursing's work easier. It benefits the entire care team.
The whole ecosystem.
Yeah, it benefits everyone. So having nurses and doctors in the innovation space at our corporate level are so important because they get the day-to-day importance of the work and understand how technology can improve that work for the staff, which improves the patient outcome.
Love it.
And that's what it's about.
Love it. Love it. That is awesome. All right. So we're coming to time, but I want to ask 2 additional questions. The first one is, if Dr. Spencer would go back in time and talk to Neve, who was 20 years old, what advice would you tell your 20-year-old self?
Don't take no for an answer. Always say yes. Be kind to yourself and that'll help you be kind to other people and walk through every door that's open and knock on the ones that aren't. And when you're given a seat at the table, make them wonder why it took so long to give you the seat.
Wow.
Yeah.
When you're given a seat at the table, make them wonder why it took them so long to give you that seat. Wow. Those are some golden nuggets right there. Golden nuggets. And, talking about seat at the table, talking about providing care. If I have a grandmother and I have options, I could take her to XYZ. Why would I take my grandma to HCA, Florida University Hospital? What's the differentiator?
I think it's the best hospital in South Florida. Sam Hazen, the president of HCA, and Dr. Sammy Mosier, our chief nurse for the entire company, they talk about how nursing is the differentiator. We have over 100,000 nurses in HCA.
Wow.
So when our nurse leaders are making decisions, they're not just impacting the nurses in HCA. They're changing healthcare across the country, and we actually have hospitals in England. So they're changing nursing and thus healthcare, thus patient care across the world.
Talk about scale.
Yeah, talk about scale. And so I am part of a big organization. And whether you're a bedside nurse that started yesterday, a respiratory therapist that's been there a month, your voice matters. That's the differentiator. We can make a difference. We listen to our staff. And, our mission statement at HCA is, above all else, we are committed to the care and improvement of human life. And when you break that mission statement apart, you can't get more simplistic and straight to the point.
Human life, not
Human
patient,
life.
not
Exactly.
human life.
We are committed. There's
Wow.
nothing more important above all else, nothing more important. We are committed to the care and improvement of human life. So nothing more important. It takes all of us, and it's all human life. Not the patient's human life, not the provider's human life, not the vendor's human life, not the employees, everyone's. I need to be as committed to my employees and how their life is going and what's best for them as I am my patients, as I am my colleagues, as am my physician partners. And we welcomed a wonderful orientation group yesterday, and I was telling them, my dad, career military, so I'm a rule follower, but every once in a while I break a few rules, like the speed limit. And also...
We won't tell anybody.
No, don't tell anyone.
Yeah.
But a couple times a day, I actually look at our mission statement and I change the words a little bit. I say, above all else, I am committed to the care and improvement of human life. Because sometimes if we say we, I may think someone else is going to
cover
pick
that.
it up and carry it for me. But a couple times a day, I personalize it.
Wow.
Because I have to be committed with every patient, every interaction, every time, with every colleague, with every stakeholder. I am committed.
Wow.
That's what makes us different at University Hospital.
What a way to end the segment. It's just been a complete pleasure and honor to have you on the show. I'm sure, talk about scale and amplification, the amount of viewers and people who will listen to this message, learn from this message, help other people, and help humanity from the message that you delivered today, from the little girl growing up to the farm to now someone who's the chief nursing officer of a large hospital. That is an incredible story, and we're so blessed and honored to have you on the show. Thank you so much, Dr. Spencer.
Thank you.
Welcome to Straight Talk with Dr. Erik.